But hey guys, this is Tanielle from the non-clinical RDH slash Think Outside the Op. You may have heard it from either one of those names. I'm here with Laurie Owens from DevDen, and she's just going to talk to us a little bit about what she specializes in, which is medical billing. So go ahead and take it away, Laurie. You can
Okay.
introduce yourself, and then we'll get back into the conversation. You guys, we were in a
All right.
really good conversation, and Laurie has some really cool things to say about how we can apply being a dental hygienist into possibly in a medical coding career. So go ahead, Laurie.
Absolutely. Because who I am, my doctor was Dr. Michael Cohen, founder of Seattle Study Clubs, and Dr. Robert Gottlieb. And I was their medical biller slash everything elser for 15 years before they retired on me. So the only reason I'm not at the practice was that my doctors have retired. I still adore my doctors and still take a lot of guidance from them on what I do in career. But it wasn't fair to the new guy. I didn't know him. It wasn't fair for him for me to be there only one day a week and not know anything about, I really believe that you can, if you believe in who you work for, then you can actually, you have more effectiveness. And so I really think in hygiene is like my love. If I could be anything, I'd probably be a hygienist. But I also know how physically taxing it is on your body.
Yeah,
but I think one of the things so one of the things we did at our practice is our doctors had 5 areas that they believed that it would benefit the patient's health to be in every month for perio maintenance. So we had pregnancy, Alzheimer's, Parkinson's, MS, and diabetes. And those were our 5 categories. We bill that to medical, not to dental. Because medical, when you do a claim for perio maintenance, it goes by age.
Okay.
So you break your procedure code instead of like the D4910, which we always usually do.
Yeah.
It's not a D4910, it's by age. So it'll go 18 to 36 and 37 to 45. And so it aggregates up to by age. And so the why is whatever their diagnosis is. It's not that you are preventing this disease. You're slowing the progression of the disease.
Right.
So we can modify it with the 33, which means it's preventative.
Mm-hmm.
So it explains the story to medical. And so I think that whether you're in an op or not in an op, do you have options there? Absolutely. You can help your patients by knowing that this procedure, because of this reason, could be covered under their medical insurance. Now, I'm not saying that they would pay every month. They usually paid about every other month, but it was so much more than they were getting before.
Yeah.
So we have to think differently. Medical has already created the codes for us in what we do in dentistry, in hygiene. One of the biggest pet peeves I have is when an office does not relate to the patient the services rendered. So what do they say on their walkout? Prophy.
Yeah.
And that's it. And I'm like, you know that they did not do only a prophy. They did oral health care instructions. They did nutrition counseling. They did smoking cessation. I'm not saying to charge for those, but we don't show the patients all of the services and the value of that hygiene appointment when we don't put them on their walkout.
Yeah. Yeah, and that translates to the value that the patient places on those services.
Absolutely.
And like showing up versus not showing up. Oh, it's just a prophy. Right. I can get that done later. They don't think about all those.
Because they're in the patient's thinking is everything the hygienist did is part of that prophy.
Right.
And it's not.
Yeah.
And we have to get back into control over how we reflect our services, because if we're devaluing the services of the hygiene department, your patient is even more devaluing it.
Yeah. Yeah.
So they take it to the extremes.
You think sometimes, Laurie, and like this is going back to the hygienist too, a lot of the audience that watches this, they might be still in the op and clinical, and these are issues that are definitely frustrating. Mm-hmm. But do you think it goes back to as well, like the pressures that dental hygienists feel in the way that the practices are run and the times being cut? I know that was one of the biggest things for us. It was like a fight against, proving yourself to be valuable to the patient and to the front office and to the dentist / fighting with like the giving the best care that you can give, doing all of that billing
Absolutely.
stuff and being responsible for it. But then like every office meeting, it was 5 more minutes that was going to be cut off the
Mhm.
patient's
Yep,
appointment. And so it becomes very difficult for you to
very
maintain
difficult.
that level. I think it's got to be a really big partnership between the hygienist and the front
Absolutely.
desk.
And I'll tell you how I figured that out. So I kept, what we most do in admin is we're gonna have you do this
Hmm.
additional. And of course, what you get back is I don't have time,
Yeah.
right? And I kept thinking, well, when I pull a walkout, all I see are perio maintenance and numbers
Hmm.
because I come from perio, just so you know.
Okay.
And
Yeah.
so I'm like, but it doesn't make sense if that's all you do, right? In
Yeah.
my thinking, administratively, how can you be running out of time? So I sat outside of Elizabeth's operatory one time and I wrote down everything she did.
Oh wow.
And so I went and then I pulled that patient's walkout and I said, it says perio maintenance and numbers. That's it.
Yeah.
I said, you're not saying what the patient did. And so I met with the hygienist and I said, how do you feel about this? And they're like, well, it just doesn't show what we really do. I said, that's exactly it. So for 1 year, we did all of those services, the ancillary services at 0 fee. But the year after, we added $5 for each. So you can see, number one, if you just off the bat start charging for them, that your patient doesn't even know they're not part of their service, right?
Right. Yeah.
So that would not be right. But once they started to see it on their statement, remember perio, they're in 4 times a year.
Yeah.
So they got 4 walkouts because every patient that left our office, whether we billed insurance or not, got a walkout.
Yeah.
They knew every service and how much it was. So what we did was we just started, once we added the $5 for nutrition counseling, and they'd say, oh, how come I have a fee? Well, we never charged you for it before. But because of, cost of inflation, it's either raise our perio maintenance fee or we actually charge for the services we do.
Yeah.
And our patients got it because we took control.
Yeah.
We wanted to make sure our hygienists started being valued by their patients. Can I tell you this? After we did that for a year, we had not one cancellation
Yeah.
in a year, not one.
Yeah. That's awesome.
So again, it's not because we were all that in a bag of chips, but we started to actually show the patients the value of the appointment.
Hmm.
And we didn't make it easy for them to try to reschedule. Because if they like a particular hygienist, in which most people do, I would say we've got about 4.5 months before she's available.
Yeah.
And so usually what happened, they'd say, well, let me move this other thing and I'll call you right back and I'll make it work.
Yeah.
And that's usually what happened. And it made better sense. So that way we could be able to give them the treatment necessary, not cut the hygiene time. We also did this. We added a sterile hygiene tech. So that tech was only working for hygiene. They didn't come to the doctor's side unless we didn't have hygiene, but we ran 4 chairs of hygiene.
Yeah. So they probably were busy.
Yeah. And so the whole idea is that they don't have to worry about who's going to be there to support them.
Yeah.
And if they, luckily I could always go in there and help them with numbers. The other thing we actually did was we got Florida Probe software so that they could actually record vacations and things like that.
I've heard of that.
So I really think that's an area that doctors need to at least do a demo with them. I actually had my hygienist do it because if they don't like it, they're not going to use it,
Yeah.
right? If they say it doesn't make sense or or the sound is bad or whatever, it wasn't about what I liked. It was if they liked it.
Yeah.
So I had all the hygienists do a lunch and learn with the Florida Probe over a Zoom meeting like this. And they said, we love it.
Awesome.
So I contacted Zoom. They actually gave us buy 2, get 1 free. So we got 3 headsets and software, and they actually created the software wearing masks.
Oh, wow.
So I think that's big to know so that it can help and it'll link into your software.
Yeah.
So you don't have to worry about adding it all later. You can talk about bleed points. You can talk about all that other stuff, and it'll put it in there for you. So little things like that to help your hygiene department get better,
Yeah.
not necessarily to try to keep cutting their time, because I think that's wrong. I think an hour is a good amount of time, if not right now an hour and a half,
Yeah. Yeah. Because
because
there's
they
too
have
much
to
work
leave.
to do.
Yeah, they have to leave that stuff solution on chairs for a certain amount of time. Do you want to sit in a wet chair?
Yeah.
No. You
Nobody.
let them have the time.
Yeah.
Why? Because maybe their notes are going to get better. Then you actually get more billing and you get reimbursed more.
Yeah.
So again, why are notes? I think you've got to find the other avenues. Yes, hygiene is profitable. Yes, hygienists do make a great living, but remember, you've earned it. I'm going to go back to that. It's not that you haven't earned it. So,
Hmm.
a lot of people say, well, you're coming from the admin side. You must be related to a hygienist. No, I know they earned it
Yeah.
because you can see the education, you can see the training and the skills. Hygienists getting out of an operatory, like I was telling you, I have hygienists that are getting their certified professional coding degrees. Well, not degree. It's a 5 hour and 40-minute course, but that's only the course. That's not the studying part.
Yeah.
It's I told him, I said, I'm studying right now for my certified outpatient coding degree. And I said, do people close to 60 get a waiver so they don't have to take a test? And they said no, but still.
Yeah. You
Um,
can always
it's,
ask, right?
yeah, but to me, it's like, I think hygienists have that clinical mindset much more than I do. I mean, truly, even much more than I do.
Well, so Laura, just tell me a little bit about, so if a person's like, okay, what she's talking about is like right up my alley. I know I have the clinical skills. I'm really interested. I've heard what she
Huh?
said about coding and how these careers might align and how I can progress as a hygienist into this different like non-clinical
Uh-huh.
sector. What should that person do? Like, what's the first steps to potentially getting involved in something like coding?
So the first steps to me would be take a course with somebody somehow. Whether it be me, whether it be, I mean, the AAPC has a course, the American Association of Professional Coders, but I can tell you it's supposed to be 13 hours worth of education that I took in less than 2.
Oh, wow.
And I didn't learn anything.
Yeah.
I wish I could say I did, but I needed the CEs for my credentials, so it
Yeah.
was all good. And so, there's opportunities. We have a medical billing company that we hire billers in home.
Okay.
So we use Weave phones so that you would be able to call and have your insurance calls recorded, things like that. So we also have people that start their own company. There's so many dentists looking for a medical biller right now. It's hard to keep up.
Yeah.
I mean, they really want the personal touch of a biller.
Yeah.
So again, making sure, join a course. If you go to our website, I have webinars on there on demand. You can kind of see what it's about, get an idea. Is this something I like? I have an office in New York City that the hygienist is the biller.
Oh, wow.
So she cut her hours and she does their medical billing for them.
Yeah.
Because again, she knows what the doctor's talking about within the notes.
Yeah.
So there opportunities. Oh my, there's so many. There's
Yeah.
truly so many. You just have to figure out financially what works. Is that something, I would never want somebody to start investing in it unless they knew they liked it.
Yeah.
Right? So my first recommendation, go to the website, look at the on-demand webinars, and just get an idea of some of the things that, we talk about SOAP note documentation, we talk about presentation. So if you say, okay, I could do that, I like that, that sounds good, then look for more. Then look to a course. See, I do have an online course that you could do an online at home, and it goes module by module. I am going to be changing it only because, things change and need to be up to date.
Yeah.
So I'm going to be talking more about law in the next series, and that's going to be going over what the laws are that we need to be careful of. Just like in hygiene, when you make a diagnosis, you have to be careful that you have something to back it up. It's
Yeah.
the same thing.
Yeah.
So, make sure you like it. Or, if you want to start getting in slowly, that's fine too. There's nothing wrong with that. Um, but again, like we talked about earlier, it's hard to get out of the operatory fully unless you're really devoted to something and you have the financial means to support you on it.
Yeah.
So I would never want somebody to just say, Laurie told me to go to this course and I don't want you, I would rather you take it slowly.
Yeah, ease out. Yeah.
Yeah, and make sure you like it, because otherwise it's just going to feel like work.
Yeah.
Whereas, because I wake up in the morning and I'm excited to go do what I get to do.
Yeah,
So make sure it's something you like. And so whatever it is you decide to do, there's so many ways that you can help people.
Yeah.
So one of the things you could do in your state is, you could be that biller that goes to their office and say, for instance, you have 10 doctors that you bill for.
Yeah.
You need to figure out what could that fee look like, because it's a lot. It's detailed work.
Yeah.
So it's, you know what I mean. It's not a lot of work, but it is very detailed work.
Right.
So you have to follow up on the claim. You have to put an appeal in. You have to do pre-authorization for specific insurance companies. So it is like detailed work, and you have to know, because I've been doing it so long in Washington, I can tell you what every insurance company here requires.
Yeah.
For American Blue Cross, I have to have a pre-auth on everybody.
Yeah.
Boeing employees, I can, for BHP prefix, I can get all these other services covered because they're part of their plan.
Yeah.
So there's lots of things you start to pick up on the more you do. So if you wanted to run a medical billing business out of your home, absolutely. Like I said, you have to make sure the notes are right, because the notes have to reflect the coding.
Right. And that's what you go off of, right?
So it's learning, helping the doctors to learn what you're looking for and get them away from speaking in dental ease. Like, I'll never forget, one of my notes said X/SRP/I hopeless number 9.
Oh,
That was the whole note. And I was like, So when I say that to you, what do you think SRP means?
Scaling and root planning.
Nope. Socket retention procedure.
Oh, yeah. Well,
So
I would have got that wrong.
So what I'm just saying, that if you were to send that out, it would not come across to everybody the same way.
Yeah.
So
Yeah.
making sure our notes are clear. And I always tell people, make your notes readable that a college student could read them.
Right.
Don't make them so technical that they say that it goes over their head.
Yeah.
And that they go, why should we approve something I can't even understand?
Yeah.
Because that's what happens. People will, your pre-authorization or your claim will get denied, not because the services were not valid, but because they didn't understand your notes.
Yeah.
So we need to go back to the reconstruction of the maxillary arch in the space of number 9.
Right.
Doesn't that make better sense than we're pulling the tooth of 9 and putting an implant in?
Yeah.
You're instead reconstructing that area.
Right.
So in hygiene, what I say differently, I would talk about the accretions under the gingiva. So you've got excessive accretions under the gingiva causing bleeding and exudate. Does that make sense? And so it's not necessarily what you're thinking, that, oh, I have to, we did all of our notes as if any case could be medical. But all of the dental insurances understood it.
Right.
So how could that be if how we're speaking medically doesn't make sense?
Right. Laurie, thank you so much for being here, for the time that you shared. You are a fountain of wisdom. I've learned so much stuff. No, I really have, and I really appreciate it. It makes me, honestly, for the first time in a long time, it makes me want to go back into practice just so I can try to implement some of these things and then see how effective it is with my patient base and with the doctors and with the assistants, because I can just see you know so much about how, even from the, like, I mean, you're doing a little bit of coding, but you're also doing a little bit of consulting on how a practice can run and how it could be more efficient and effective, and that the employees could be a lot happier because they don't feel so stressed out when we take the power into our own hands and we train our patients. And so for the person who's thinking about possibly doing some coding, it looks like there's some opportunities to do that from home potentially, or you could start your own business. Laurie has a course that she had that you could take that looks like it's about to get some revamping. So Laurie, why don't you tell everybody where they can find you if they want to have a
Absolutely.
conversation with you, if they want to pick your brain, just go right ahead and tell us where we can find you.
So devdent.com, DEVDENT, stands for Developing Dentistry. That's what we're all about. We all come from the dental field, and so we've all we've been there. I've been in the place where I had to teach myself how to do medical billing. So I don't want you to do all my mistakes. So I teach you how to not make the same mistakes I did. So the online course, I think it's $6.99. If you have a Henry Schein rep, I think they have a coupon code, so you could get a coupon code, but it is on demand. So you don't have to watch all of it at one time. You can take it module by module. And we go through all the classifications of billing, including a hygiene section. So just, that's a good place to start. Go to the website under devdent.com and education, and you'll see webinars. So you can watch on-demand webinars to get a feel for, is this something that you'd like to do? And then, of course, if you want to do a live course, I go to cities all over the place. I think my first city is going to be in Columbus in September or October. I can't remember. And so just look for, what do you like to do? Retrain your patients. If you're working now and frustrated, it might be your admin team doesn't know how to train the patients. In dentistry, we all feel bad. So we all give things away. And we really shouldn't be doing that, because that means you're not worth it, and you are.